Good morning, everyone. Once again, I'm John Newstreet, the President and CEO of your Kissimmee Osceola County Chamber of Commerce, and we're delighted to bring you the third in this webinar series dedicated to the COVID-19 crisis and resources available to you. You may recall, and it's archived on our site and our resource page at KissimmeeChamber.com, the two previous webinars we've hosted, one on the congressional stimulus package and the new aid related to PPP and EIDL. We'll do a follow-up to that in English and Spanish next Thursday. We've had that one the first week. Last week we did one with Mary Downey from Community Hope Center on community resources available to you. So as a reminder, our mission statement, which we are very true to, is champions for business and community. And in light of that, this webinar series dedicates itself to giving you those resources so that we can all be champions in our daily lives. Today, we're joined by two experts in regard to the mental health topic, something that is affecting all of us on a daily basis, but especially through this COVID-19 grind. Claudia Swonger from the Osceola Regional Medical Center is here to join us, and later on in the webcast, we'll be joined by Kristine Zwick of REACH to talk about a program that is sponsored by the Osceola County School District. So if we can bring Claudia Swonger up from Osceola Regional, we'll make a quick introduction. Good morning, Claudia.
Hi, good morning. How are you, John?
I'm very well, thank you. That's a wonderful smile, and it's, of course, needed in days like this. So I'm going to turn it over to you. I know you've got some tips to help the audience here, and I'll be checking in with any questions that come in through the live feed. So a reminder to our audience watching now, there is you can post a question in the comment section. We will get that live and do our best to address it during this broadcast. With that being said, Claudia, the show is yours.
Awesome. Thank you so much, John. Good morning. It's an honor and pleasure to be here, especially to talk about such an important topic that I think during this time, each and every one of us can relate in some shape or form. So I am the Director of Physician and Provider Relations for Osceola Regional Medical Center Behavioral Health Program. And we are proud to be the behavioral health program of choice in Osceola County and Greater Orlando with our outpatient and inpatient services. So I just want to go over some tips that we can all relate and practice to stay mentally healthy during COVID-19. This was something that one of my peers from our behavioral health program created. So just to go over, it's important to understand and to know that this will end. Right now, our biggest thing is that there's a lot of things in our life that we feel that we can't control. So it's important to focus on those things that we can control. Our feelings, our emotions, perhaps things that are happening in our home, with our family, with our children. So it's important to focus on those things that we can control. Set a limit for news exposure. I know we all want to be informed and find out what's the newest information regarding rules, regulations, precautions, everything regarding COVID-19. But it's important to not overdo it and not obsess about it. So simple things can be turning off the notifications on our phones regarding news, or limit also social media regarding that. Keeping a daily routine. Normalcy is very important to stick to, and to think that life goes on as usual. So if you have a schedule regarding wake up and bedtime, continue that. Get up in the morning, get dressed, and just try to stay on that schedule and that routine as best as you can. Incorporate physical and mental activities. Exercise is proven to definitely improve mood and feelings and emotions. So just simple things as a simple walk, even if it's around your house, up and down the stairs, if you have stairs, a couple of simple stretches, yoga. Nowadays in social media, there's so many resources out there on YouTube, simple workouts that you can do. Meditation, YouTube is full of meditation videos. So just try to do something like that to help you with staying mentally and physically active. Make social distancing manageable. And of course, our next speaker, Kristen, will talk about the CheckIn Project, but check in with a buddy. Reach out to family and friends. It can be just a simple text. It could be an emoji with a thumbs up or a smile, thinking of you. How are you? I'm here for you. It could be just something really simple, yet it can be so powerful as well. Think about today. Part of anxiety is always thinking about what if and what's going to happen tomorrow or next week or next month. Let's try to focus on today and to be present and be more mindful. Um, it's important to think about, let's take this one day at a time, because we don't know what's going to happen tomorrow, but we do know that we can focus on what's happening now and today. Rely on experts to make difficult health related decisions. It's important to trust and just listen to those precautions and those suggestions, and not underreact or overreact either. And of course, it's finding that balance with that. And lastly, I'd like to talk about asking for help. Um, there's so many resources out there, that goes hand in hand with checking in with others. So know that when you feel that it is affecting your everyday routine, anxiety, depression, perhaps some negative thoughts, ask a family member, friend, or caregiver for help. Or if you feel that it is, you feel in danger, or you feel that it is affecting other people's lives in your home, please seek professional help. Um, our information is on the screen for our 24-hour intake department. Um, we are there to help you and support you in any way that we can. And we recently added telehealth services to our outpatient clinic as well, to be able to serve patients during the COVID-19 crisis, so they can stay at home and yet still receive those services that they are in need of. So know that it's important to recognize when this is affecting your life, because I think we can all relate that this is affecting all of us in some shape or form. But when it does affect everyday activities, your relationship with your family, friends, and work, that's when it's important to recognize that it is important to seek professional help. Any questions at this time, or?
Thank you, Claudia. I've been monitoring the chat comments, and so far we've put some information in the thread for folks to follow up, but no questions have come in. So hopefully everybody's feeling good, and we'll take the advice and build on that. So, but before we turn it over to Kristine, and in case some questions do come in for you, I wanted to just talk about a few things, stress some few things maybe that are important for the audience to really grasp. One, you said that this will end. This is a pandemic. The last one of this severity was 1918 with the Spanish flu. That lasted about a year and had, two different swells, if you will. So there's every confidence that, day by day, this is tough to see, but very high confidence with the field of experts we have in medicine locally and nationally and globally, that this will end. And so do you want to kind of talk to that again, just to reiterate how important that is in the psyche?
Sure. So as I mentioned before, this is the hardest part of COVID-19, is that this is something that we can't control. So that causes some anxiety, some worry, some negative thoughts. So again, it's focusing on those things that we can control, and trusting that with our technology nowadays, science, research, it's important to focus on how advanced it is now, and how hopefully we'll be able to see a light at the end of the tunnel, as we trust our healthcare professionals and leaders to make appropriate decisions.
So you mentioned healthcare professionals, and I should have said this at the outset, but I share the sentiment of my staff and my leadership and all the community in saying thank you to all those in healthcare, you included. and all the team there at Osceola Regional Medical Center, thank you for what you're doing day in and day out to get us through this crisis and keep us safe. Can you talk about, and you feel free to reiterate what ORMC is offering, but I know Park Place Behavioral is another area to get assistance. So can you talk to other things in the landscape? Kristine will be in just a minute, but just where else folks can go or what else is available that they can benefit from in the community?
Absolutely. So NAMI, National Alliance of Mental Illness, is a wonderful organization, and they offer all types of resources, from support groups to just other types of events and resources regarding mental illness. And their biggest job, of course, is to end the stigma regarding mental health. Mental Health Counselors Association of Central Florida, they are also a great resource. There are a lot of resources out there for first responders as well. GivenHour.org, I believe, is a resource to provide services for first responders. And what I've seen a lot is a lot of these counseling centers are offering special services as well for healthcare workers. So there is a lot out there. It's just a matter of finding it, and I'll be glad to share also some links regarding all those other resources as well.
So we've got a comment here to expound on, if you will. As healthcare professionals, how can we reach out to support each other and show them that they are cared for and not forgotten? Can you talk to that?
Oh, goodness. Like I mentioned earlier, it could be just something as simple as a text, a phone call, a positive message, a card. Believe it or not, now people are mailing things now to reach out to others because of the social distancing. So it could be just something as simple as a text saying, "I'm here for you," or just ask them, "Is there something that you need? Is there something that I can help you with?" And you'll be surprised. A lot of people will answer that question and let you know what is it that they need from you.
And the idea is, of course, just to let folks know you're thinking about them, right? So we, I guess to take a minute to toot our own horns, we are very appreciative of all of our partners in the community, but most grateful to our healthcare professionals. So the Celebration Area Council of Kissimmee Chamber just recently recorded individual videos and to say thank you to our healthcare professionals. So we're putting that message out and asking all of our partners to remember to take that minute to do like we're doing now, record a Facebook Live video just saying thank you and watch that organically reach the folks that you're trying to touch and encourage right now.
Right. I think it's important to also keep in mind, John, that we are all being affected by this. Every person in this world is in some shape or form. So now there's like this commonality now with us. And from the mom who's now having to homeschool the children to our healthcare workers that are putting their lives at risk. So everybody is being affected by this, which, as you mentioned before, this hasn't happened in a long, long time. So just understand that we're all going through struggles and challenges. So it's important to just take it one day at a time and be compassionate with yourself and pick our battles regarding homeschooling our children and being home with them. And just think about today, focusing on today. That's very important.
So let's talk about one last thing before we switch to Kristine, and then we'll have a Q&A at the end as well. But, anxiety, depression are very real. I think everybody grips with it no matter how tough they pretend to be. And so talk just real quick about that stigma and how important it is in the overall health, just like physical health, how important mental health is.
Absolutely. So just how when we get sick and we feel the need to go to our physician or we feel the need to take something over the counter to relieve those symptoms, we should feel the same way when it comes to mental health. When we feel that perhaps we're not being ourselves or we're not performing as we used to regarding just our daily activities, our family life, it's important to be mindful of that and to understand that it's okay to seek help. There's so many resources out there, so many people out there that are available to help you, that it's important to seek those resources and reach out. And to just remember that it's okay to feel this way. It's normal to go through certain feelings and emotions. They may be temporary, they may not, but if not, then let's find a way to manage them so we can just find that balance in our lives to be able to live a full life again.
I appreciate that. We'll be back in touch, but I'm going to bring up Kristine Zwick now to talk about a neat program we have. It's a CheckIn Project. And so Kristine Zwick with Reach is the person to talk to about this program and all the good things they're doing. So Kristine, without further delay, I'll turn it over to you for maybe an elaborate introduction and or to get right into the meat of the program you all have.
Thanks, John. Good morning, everyone, and thank you for having me here. I'm excited to be able to talk about the CheckIn Project. It's a mental health program that is through the school district of Osceola County, and essentially our goal is to normalize conversations around mental health, hence the name CheckIn. So we encourage people to check in with one another daily, set a goal to check in with your neighbors, your friends, or family. You can learn more about the project at the checkinproject.org. And specifically, I want to talk about business owners and employers today. If you're an employer or you own a business, the mental health of your employees should be the top of your mind. You're probably working to prevent burnout, especially among essential workers who could be working overtime. So the cool thing about the CheckIn Project is we help you to start those conversations with your employees and to prioritize mental health in your workplace. So if you head to the website and you go to the resources tab, there's resources for businesses in there. And really quickly at a glance, it'll show you how to prioritize mental health in your workplace, why it's important for your employees, and how to start those conversations. We also have a blog as well on the website, and we published a piece specifically about managing mental health during COVID-19. We've got tips in there from SAMHSA. So that's a good place to start if you're really not sure where to go for your mental health. And additionally, if you're an employee or an employer and you have families in your organization that are struggling, like Claudia said, to balance, being a homeschool teacher and a mom, having your kids home full time, we do have resources for parents as well. You can find that again under the resources tab. And in there, it'll show you everything from how to begin the conversation, how to set aside time, what questions to ask, and why it's important to do that. So if you are in need of resources, the CheckIn Project is a great place to start. You can find the link in the comment section, and it's the checkinproject.org. Additionally, on our Facebook, or all of our social media, we have tools for you. We've got examples of open-ended questions, how to ask questions to start conversations. We've got expert chats on there. We had Joy Chuba from Embrace Families, and our friends at Help Now do some expert chats for us around domestic violence and family health. So that's all on our social media as well. So anything you could think of, we've got resources for you, and it's all for the public, again, just to encourage people to start conversations and teaching them how.
Thank you, Kristine. So this program is free, and although it's sponsored by the school district, it's open to the entire public. Is that right?
Yes, absolutely. So it's actually a part of Wraparound Osceola, which is through the school district, and they got a grant through SAMHSA to, part of it is to promote mental health to the public and to educate the public and break the stigma. So that's where the CheckIn Project comes in.
Very good. If we can bring back Claudia as well, and I haven't seen any additional questions, but we'll just get you all on screen here. I'm trying to get to the live section, working my phone. So Another question, and I think this goes more towards Claudia. How can I present this information to my employer without being stigmatized? Are there any helpful tips? Or Kristine, if you have a thought on that, since you're engaging the business community.
Sure. Yeah. We're actually working on a blog about how to talk to your employer about mental health. One of the first things is that you don't have to talk about it if you're not ready. Don't feel pressured to do that. If you do think it's affecting your work, you can ask for accommodations like more breaks during your shift if you're feeling burnt out, or having a day off between 2 days in a row. Working around a schedule with, if you have therapy appointments or you need to see your psychiatrist, being open with your employer about things like that. I think they'll be completely understanding because, as Claudia said, it's just like a medical appointment, any other appointment that you would have. And then our other tip that we have is to talk about it when you're in a good space. So it takes out the urgency around talking about your mental health. If you are feeling overwhelmed and you're not, you don't think you can have that conversation, if you're feeling like you're a little on edge, you can definitely, you can do things like call 211. They can connect you with a crisis counselor. Just to help, talk you down, talk to your therapist, text them, email them. And then when you're feeling better, when you feel like you can have that conversation clear-headed and in a good space, that's a good time to bring it up with your employer.
I appreciate that. Claudia, you want to expound? And there was a question too about, and I don't know if you're following that chat, but it talked again about the hospital. How can you reach out to the hospital and what are they offering for consumers? So we can get to that question next if you can follow up on Kristine's comments there.
Sure, absolutely. So a lot of employers, they also offer something called EAP, Employee Assistance Program. This is something that is confidential, and most employers do offer. It is free counseling, a certain number of free counseling. So maybe something else to keep in mind, if they don't want to go directly to their employer, they can just call their EAP and seek help that way as well. That's always a good resource as well.
Very good. And then how do I reach out to the hospital if I feel I need help? What is being offered?
Sure, absolutely. So we have a 24/7 intake department, and they can call anytime with any types of concerns, questions, to get an assessment over the phone to see how we can assist in their needs. And that phone number is on the the screen that I was going over, but I can go over it again. It's 407-518-5835. And then we also offer an outpatient clinic that includes a partial hospitalization program and an intensive outpatient program as well. And that phone number is 407-518-1143. And we just started offering telehealth as an option to accommodate these patients during COVID-19 that aren't able to leave the house, or just to make sure that they're safe. We also offer that as an option, as well as in person. We're taking all the necessary precautions, practicing social distancing. We're limiting our group size to small to make sure that everybody's safe. So we are here to assist with any questions. Just give us a call, and we'll try to assist as best as we can.
Very good. We put the intake hotline inside of the thread there, so that's readily available. So as we wrap up this conversation, is there anything else you'd like to share or reiterate before we wrap up? We got it all covered. They can hit rewind. They can watch it over and over again. So
be kind to yourself, practice self-compassion. This is hard for all of us. This is new for all of us. So just be kind to yourself.
Amen, Kristine. Yeah.
Yeah, and I would touch on what Claudia said, to find a check-in buddy. It can be anyone from your friends, your parents, your child's teacher, your neighbors, and make a commitment to check in with them once a week, once a day. If you head to the checkinproject.org, we're taking pledges from people who are willing to commit to check in. And with that, we'll send you resources monthly and weekly on how to do that. So we'll support for even our endeavor. And just be kind, like Claudia said, take a genuine interest in how the people around you are feeling. And I think having those conversations can go a long way.
Absolutely. This is also very helpful. We are very grateful to both of you for taking your time and sharing your programs and your expertise with the community. I'll remind the audience, our mission statement at the Chamber is to be champions for business and community. And through this COVID-19 crisis, we've adopted the hashtag #ChampionsAtJust. And so, as you've heard, limit your exposure in social media. Don't let it drain you. This will end. Anxiety, depression are real, and we need to overcome the stigma and get help and treat it like we do our physical health so that we can all stay strong. And I'll sign off with this. A thank you to both of our guests. A thank you to our viewers. And remember to stay healthy, stay safe, and for now, stay distant. Thank you.
Thank you. Have a great day.
Thanks so much.
Bye.
Bye-bye.